Now, this surgery is what is known as a bilateral orchidopexy. So what is a bilateral orchidopexy surgery, and when or which conditions will actually make you want to do this type of surgery? Okay, so bilateral orchidopexy, just so you know, is a surgical procedure is performed to correct or undescended testes. So if the testes, sometimes you have the testes, the testes develop in the abdomen before they go down. So sometimes they can develop and remain in the abdomen. Sometimes they can develop, start coming down, but get hooked on the way. Do you understand? So bilateral one is you want to actually fix. That's like your two testes didn't go down. Do you understand? So it's like the two testes didn't actually go down into the scrotal sac. So you want to actually surgically correct it. So indications is undescended testis, of course. That's what is known as cryptorchidism. Sometimes it's testicular torsion. Okay, then sometimes it's erectile testis. Okay, retractile testis rather. Okay, retractile testis. It could be that the testis is coming down and going back. Okay, so why is it important? Of course, it will help to restore the fertility of the person. Testis is outside the body because the temperatures outside the body is below. So if you have a testis developing in the abdomen where the temperatures are high, such a person can have risks for infertility. So if testis is also developing where it is not supposed to develop, it can cause testicular cancer. Okay, then of course you want to actually prevent testicular torsion. Okay, so that's what we have. So if for cryptorchidism, you should know that it's usually done between 6 to 18 months of age. Okay, so the incise, the testis and the spermatic cord are freed from any other attachment. The testis is now brought down into the scrotum. Then you don't just bring it down and leave it because it can go back. Okay, so this one is abnormal, so you have to actually suture it. Like you have to use one or two sutures, then pin it. Okay, so that it's not disappearing again. So that's what we have